Welcome to the Health and Wealth Power Hour, the podcast that provides you with the knowledge and insights you need to achieve physical, mental, and financial well-being. I'm your host, Harlon Pickett, a business consultant who's passionate about helping people achieve a more balanced and healthier life. Each week, we'll deep dive into topics related to health and wealth, including retirement income planning, innovative healthcare solutions, alternative funded health plans, and specific actions individuals and business owners can take to gain control of their finances, have access to affordable quality health care, and achieve peace of mind. We'll also be joined by innovative experts who will share their knowledge and insights on prevalent topics. So, whether you're looking to grow your wealth or improve your health, you've come to the right place. Get ready to be informed, inspired, and empowered. Let's get started. Well, guess what time it is? It is time for another exciting episode of the Health and Wealth Power Hour. Let me tell you something, folks. You are in for a super treat today. I had a conversation with this gentleman last week, and we've had multiple conversations, but I had a conversation with him last week, and man, there is no telling where this thing's going to go. I'll just tell y'all right now. But you are in for such a treat. We have a gentleman here that has spent a long career out helping folks as a family physician. And he came to an epiphany one day that he could help them in a better way. I'm going to let him tell you that story, but you are going to be shocked at the wisdom, the encouragement, and just the overall mentality of things, the way that they change and the way that you should look at them differently that he will bring to you today. I am talking about the one, the only, the amazing. Is it okay if I call you doctor?
You can call me anything you like, Harlon.
Dr. Gregg Stefanek is with us today. Gregg, thank you for joining with us on the Health and Wealth Power Hour. Appreciate you being here, buddy.
Well, I'm honored to be here, Harlon. I was looking at your previous guests on your show, and I was just really, really impressed with the variety of people that you've talked to. And I just hope I hold up my end as being an interesting listen for your viewers or your listeningship, whatever you call it.
my viewership. Oh, wait, no, they don't look at anything except their device, right?
And it's a good thing we're on radio. It's a good thing we're on audio only because I have that face for radio. So it's
me too. That's why I'm here, brother. That's why I'm here. I scare people every week on Mondays by doing the kickstart and giving the people on industry news. I scare them then by putting my video out there. But, I figured just one, if they only have to look at me that once a week, maybe they'll be okay.
Well, Harlon, where do you want me to start? How far do you want me to go back until I came to this epiphany?
Well, I don't think we have to go back to your childhood if you don't want to go by that far. But you did have a very interesting career because you were in as a clinician. You were a clinician for a number of years as a family medicine. But talk a little bit about some of the fun things that happened during that, some of the more interesting things that you dealt with in family medicine, and then take us to your epiphany. Take us to, because right now folks don't even know what you're doing. So I want them to hear why you made the decision to do what you're doing now, because I think it's just extremely interesting that you made this jump to actually be a doctor of a different kind now.
Well, very good, Harlon. Well, actually, we'll start a little bit. I actually graduated from University of Notre Dame with an accounting degree and worked for a year and a half as a public accountant. And I can remember specifically April 19th, 1981, Easter morning on the beach in Fort Lauderdale where I was working and watching the sun come up saying, I don't like this accounting stuff. What do I want to do with my life? And I said, I want to be a doctor and I want to be a family doctor and I want to help people feel better about themselves. So for some reason that hit me. And it wasn't until a couple months ago that I actually realized why I wanted to become a family doctor, which I'll share maybe later in the show. But I had to come back home and take pre-med courses, and I did some volunteering because I didn't know whether I could handle the blood and guts. There was no doctors in my family. But that was a wonderful time, exploration time. And I had a job as an orderly, Harlon, and my 4 jobs as the orderly working night shift were, number one, I had to fill up the water bottles of people at their bedside. I had to shave men before surgery. Get this, back in those days, hernia surgery, you admitted the person the night before. and you shaved them the night before, and they had surgery the next day. And that was one of my major jobs. Of course, we realized it actually caused more infections to do it that way because you're better off shaving them right before the procedure, but we didn't know it back then. I had to catheterize men who came out of surgery and couldn't urinate, because of the anesthesia. Oh, I'm telling you, these guys were so happy when I came in with this thing because they just couldn't go. But my favorite job was taking bodies down to the morgue in the middle of the night, and loading them on the gurneys. And boy, they make some funny noises when you do that. And
Wow.
so that was, and of course, the morgue was in the basement. And of course, I was by myself. So it was an interesting time. So I passed that test, and I knew I wanted to be a family doc. So I went to Michigan State Osteopathic Medical School, and I found a beautiful practice in small town Michigan, Alma, Michigan. I was there for 27 years, Harlan. And I was throwback. I was, for those old enough to remember Marcus Welby, but I basically was Marcus Welby. I delivered the babies. I insisted on the surgeries. I took care of all my hospital inpatients. I went to the nursing homes. I even shoveled the walk in the morning, literally, and loved it. There was no talk of physician burnout back then, or it was just, we were in it together, and we were there for our communities. And it was just a great atmosphere with partners who were just delightful human beings who, we were so different in every aspect of our personality, but we never once had a business disagreement because we cared about our patients, we cared about our staff, and we cared about us, in that order. And it was a beautiful practice. But after 20 years, my partners are getting older. We're looking for exit strategy. We sold to a regional hospital system, and that was a good partnership for 7 years. But eventually I came to learn that what they were interested in more was just the referrals and how many patients I saw. And I kind of got a little disenchanted with hospital work. And I came across this role to work for a company called QuadMed, who is an on-site medical supplier of family practice clinics. And I got to go work at a Fortune 75 company in Midland, Michigan, at Dow, being the medical director, family physician. There almost 5 years. We started a clinic from scratch in Midland, but we had 3 other clinics up and running, 2 in Texas and 1 in Pennsylvania prior to the one in Midland. But I came to see, Harlan, the role that the employers have in taking care of their people and the power they had to put powers in place and systems in place to help their people thrive. But I also saw typical HR of a large company, too busy, overwhelmed, overworked, didn't want to consider new ideas just because you're afraid of the change and upsetting their people. So I said, there's a better way to do this. And so I came across a book written by my current boss named Phil Berry, and the book is called Nexus of Care. And the idea was that an employer can have a nexus, a central hub, a strategy from which to take care of their people in a better way. And so I said, I think I want to do this. I want to go off into this employer healthcare space. And then once I got into it, the thing that surprised me the most is the power that people like you have, Harlan, to advise employers, the power that the brokers and the advisor had in this space to make decisions on behalf of employers, and the trust that employers put in the advisors to make those decisions for them. And so that's been my biggest surprise, I think, entering into the space of employer-sponsored healthcare and benefits, is the power that the advisors and brokers have. But together, the brokers and the employers can put a plan in place, can help their people thrive and succeed. And I believe that they have more power over people's lives than I did as a family physician. So that's kind of where I came to this place right now. And it's been an incredible learning experience. I've been doing this since last August. So I'm still relatively new in this space, but I've learned an awful lot.
Yeah, it has been, I've got to know you over almost the last year since you started this journey. We met not long after that at the Hint conference as well. And we've talked a lot about various different things, but I really thought it was interesting. Here you are, you're a family doctor, and at the time that you kind of made the transition, you were a family doctor for a company, as it were. You were an on-site physician making a big impact in those people's lives, and that's obviously what was very important to you. But you had done enough with a company that had what is quite honestly a very good idea, and that is on-site physicians, on-site, near-site physicians. It changes the dynamic of your employees. It's a wonderful thing because people are more likely to get care. But what you were able to also see is that most companies are not down. Most companies are not big enough to be able to afford to have those type of situations. So how do we make an impact on the other ones? So that's what your goal is now, is to help spread the love, as it were. And And I'll tell you, I think it's interesting that you bring up the fact of how much power in that brokers or advisors have in this situation. And I really don't think many of them even look at it that way. I don't think that they realize how much power that they have and how much bad in many cases, how much bad they're doing. I mean, these are literally life and death decisions that are being made in some cases, and no one in that particular situation looks at it that way and understands it in many cases.
I think you're right on, Harlan. I think a lot of the brokers have had that reaction when I've said, well, your job is more important than mine in helping people live better lives. But you know what? What happens when you have great power, right? What you have to have is that great responsibility.
Right.
And I think part of it, in fairness to them, it goes back to the incentives. I almost can't blame a broker who's making a great living by selling a fully insured product to an employer who, and he's getting paid from the big insurance companies behind the scene. He didn't necessarily ask for it. That's the system that he walked into or she walked into. But I think the responsibility aspect of it now is, okay, now that you know that it's not really adding value, now what are you going to do? And there's people like you and people in the next gen world, e-powered world, and the Health Rosetta world, these brokers, advisors who are finally understanding what their obligation was. And I want to make one thing clear too, is I didn't leave my last role because I was burned out. I've actually been honored never to feel like I've been burned out in medicine, even though I know the pressures that are under physicians. I think this talk of moral injury is not real helpful in this space to physicians to sit back and complain that they're being morally injured because they're being asked to do things that take them away from their job. I agree there's a lot of things that can be improved in how physicians' workflow is, but they have choices. They can go into a DPC practice. The reason my model in the on-site clinic world works so well, Harlan, because the incentives all in line. What my employer wanted, what my client wanted, what I wanted, and my patient wanted was the same exact thing. We wanted them to be so healthy, they did not need a lot of healthcare. And that's not the way the current system is set up. And you know that. So even though I wasn't a DPC physician, practicing in direct primary care physician, practicing under this model of on-site care was basically the same thing. We all had the same motives, and we understood our responsibility to help steward an employer's limited resources to the best of their ability.
Yeah, so let me go back for those of you who may not be 100% in on the differences or the sames of on-site or DPC. While we do have some DPCs that can or do work on-site, typically an on-site clinic is a practice like you were working with that just does that, right? They may have practices at different companies, but they just do that. A DPC is typically what would you consider a near site, or they are in a community. They're community-based folks that are membership-based, but many of them work with businesses in that community to provide those services. The difference is that company doesn't have to afford to have a doctor on site then. Now they've got a company doctor, but that company doctor has typically a brick and mortar. There are times when maybe if the place has a clinic, that doctor may come in once or twice a week, or have someone from his practice come in once a week and take care of folks on site. But as a general rule, what DPC brings is kind of what you did, Greg, as an on-site. They bring that to smaller companies that cannot afford to have that type of situation. Then if you have a quality advisor that understands the importance of this, then they build the plan around that. Now, that doesn't mean you can't do fully insured, especially if you're starting to take some baby steps. DPC is a great place for a first baby step to start going towards a non-traditional setup. But the way that the plan should be really built to do the best for everyone is centered around primary care. I had a very interesting conversation with a gentleman yesterday at a trucking company out of Houston, and he just didn't get it at first. He just didn't get it. He's like, but I don't understand. I mean, these people are going to need, what if they had, some kind of chronic problem that doctor can't take care of. I just don't understand how this works. If they've got chronic heart issues, or, they need to see a gastro because of this or that, what's going to happen? I mean, I said, okay, I'm not talking about that they can do everything. I'm saying they can do 80 to 90%. But the big deal about the primary care is to keep them from ever needing that specialist by getting them the primary care and getting them the day-to-day things that help them not get chronic. And you could just see the light go off. You could just see the look in his eyes change when he goes, oh, I get it now. You're not saying they can't go there, but we don't want them to go there because they never needed to. Exactly.
Exactly right. Those are great points, Harlan. And I thought what made me a good physician, Harlan, was not the tests I knew how to order, is when I know I didn't need to order tests. When I really looked at that patient and shared the process with them and saying, you've had this pain for a day or two. You don't need a CAT scan today, but if you don't get better, then let me know. We can go next steps. But having that shared responsibility really was a great way to practice medicine. And also it's a great anti-burnout method when you tell your patient, and I told my patients this, Harlan, I said, it's not my job to take care of you. That is your job, but it's my job to support, guide, encourage. I always thought the definition of physician as healer was a little arrogant, because I can't say I've ever healed anybody. Have I brought cures to people? Have I helped them along the process? Have I facilitated part of their healing journey? Absolutely. But I like the definition of doctor as teacher. And that's when you teach a person how to take care of themselves. And that's really what I did. Interestingly, the great thing about the DPC world and about the on-site clinical world, the most patients I ever saw in a day was 15. Mostly was between 10 and 15. The first question I would ask someone, Harlan, when I came in for their yearly checkup would be, tell me what's going good in your life. And sometimes they would be taken aback saying, what do you mean? I'm here to, no, I want to know what's going good in your life. Because I always felt my role as a physician and my role at Dow was not to just put a clinic in place, but to help people understand their responsibility to take care of themselves and my job to support them in their efforts. That's what really made me feel like I was doing my job. And when I left my practice of 27 years at my first job, and you can imagine it was hard to leave patients that long.
Sure.
I mean, these are people I delivered. I took care of 5 generations of families. By far, the most common response I got when I said I was leaving was saying, wow, I'm happy for you. What a great opportunity for you. And the second one was, now what am I going to do about a doctor? And I had a lot of nice cards from people, and it was nice to get them and read them before I died, so I actually could read them. And a lot of people said they felt cared for, and a lot of people said, that I helped them through a hard time. But one guy said, Doc, I'm going to miss our conversations, but you've taught me how to take care of myself. And that's the one that kind of meant the most to me, because that's really, I thought my role was. And again, when you have that patient take care of themselves, then you don't feel that onus, that burden, that responsibility to be the one responsible to take care of them. It actually helps the burnout. Yes, there's still reasons why you can be overwhelmed, but putting the onus back on them and teaching them and giving them more information than they had before and complimenting them and reminding them the good things in their life, it's a beautiful way to practice medicine. And that's the way I think every physician should be able to.
Yeah, that's a very interesting take on that, because, when we were talking about this beforehand, and even when we were talking about this last week, that seems to me, and maybe I'm completely wrong, maybe I've just never heard a physician say it the way that you have this time. It just seems to me that that's not what you typically get from a physician, that you almost get, and I'm not saying all of them do this, but I think as a patient, sometimes you feel like you're being talked down to, not being talked to. Right, not being a shared, as you said, a shared responsibility, not someone who's supporting me, but someone who's dictating to me, somebody who is, really almost drawing a line in the sand and saying, if you don't do this, there's nothing I can do to help you, right? And we recently had someone who was working with a physician who called us and said, I don't know what to do in this situation. I told this doctor I didn't want to take this medication, and they got mad at me. They got angry at me for not wanting to take the medication they wanted me to. And they just said, well, then go Google a solution.
Yeah.
What? Really, your physician told you that? If you're not going to listen to me, then just get on the internet and look for an answer there. that should be the last damn thing your doctor wants you to do is go look on the internet for a solution, right? I mean, come on, that's crazy place out there.
Well, actually, I'll disagree with you a little bit on the Harlan. I really like my patients to go online and read. I always thought my visits with them went better. They were more engaged. It's about patient engagement. So many physicians, will give the patients that look like, oh, you read on the internet, huh? Or you want to be your own doctor now, huh? I think that's wrong. I think, encouraging people to be more active. And I rarely got people that wanted something because they read on the internet or they watched the TV ad for a pharmaceutical, medication. They came in and they wanted it, but when they did have a little more work and of course, I came from a Fortune 75 company where they had a lot of PhDs, and these people knew more about the pathophysiology of the disease than I did. But everybody, even the lowly guys on the operators, the people who, the janitors, I'm not going to say lowly, but the people who have a job that's not as, as prestigious, they are capable and more capable of taking care of themselves than they realize and have given permission to. Harlan, I think a lot of physicians haven't given that patients that permission to be the active participant and instead of being trained to be a passive recipient. And I think that's just wrong.
No, and I agree with you. I can tell you that in my family, we want to learn some stuff before we even go talk to the doctor about it. But when a doctor, in this case, seemed to be offended, now, once again, I'm hearing from a client, but, that seems to be offended that you won't take the medication I told you. In this case, full transparency was statin. The person did not want to take a statin for whatever reason. They didn't want to take a statin. And the doctor said, well, that's your option. And if you're not going to do that, then just go find you an answer out on the internet.
Yeah.
That's not empowering. In that case, that's not empowering them. That is punishing them, in my opinion. You just punish them for not listening to you. And if you're not going to listen to me, then just go find your own solution. That's not guiding. That's not supporting. That's not teaching, right? That's none of those things. That is, I know better than you. You do it my way. And if you don't do it my way, well, then, do something, then good luck to you. My advice to her was, we'll find another doctor. It's not,
absolutely.
I mean, that's an easy thing. If you want to go online, that's fine, but go find another doctor. There's plenty more doctors out there.
I think if you asked 100 people, what the most important characteristic of a physician would be, you probably get 100 answers that are the same. I want someone who listens to me. Yeah. I want to feel cared for. I want to feel like, that I'm respected. And that approach doesn't work, Harlan. And frankly, I'm a little bit disappointed with most of my physician community. There's great docs out there. My parents were, my dad died last year. He was 96, Harlan. My mom is 96. And my biggest role as a son physician in the family was to make sure nobody killed them. But their doctors get it. I've had wonderful conversations with their doctors, and they're saying, we don't really need to do this now because it's not going to really help. And getting the whole family involved in the decision process, I think, is vital. But a lot of physicians, Harlan, are just good at sitting back and complaining that things aren't better than they are like they used to be. If physicians were to stand up and be fully aware of what's happening in our healthcare system, because a lot of the surgeons who work for hospital systems have no idea what's being charged for their procedure, right, or what's being billed. They have no, and I think that's wrong. And I read this a while back, Harlan. I really like this. There's a you can have a backroom brawl or you can have a country club brawl. A backroom brawl, there may be knives involved and weapons, and you might be fighting for your life. A country club brawl is when you're all making pretty good hay, but one making more than the other. And unfortunately, that's what most doctors have, is they have these country club brawls. Because if you Google the top 20 salaries in the country, Harlan, 18 of 20 are physicians. One's an orthodontic surgeon, and one's a CEO. And CEO ranks number 17. And of course, that low because there's a lot of small company CEOs. But and again, I do sympathize with doctors. There's things that need to be different. But if doctors were to stand up and be part of the solution, instead of about complaining and being, and just making the status quo go on, well, we can make a world of difference, I think, if physicians were to unite. And there are some groups coming around that are doing that. I think that's wonderful.
So you talked about when you kind of made this transition over, one of the things that surprised you was how much control, influence, as it were, that a broker or advisor has with the employers. What are some of the other things that surprised you when you came over here to the dark side? When you came over here and you saw, and this actually isn't the dark side. This is the light side. The dark side is the people who aren't working towards these positive things. But what are some of the other things that really you were not prepared? You not. I'm not saying you weren't prepared for that surprised you that you didn't realize what were out there.
Well, just to let you know, this ties into it. Right now, my current employer is actually a pharmaceutical. Northwind Pharmaceuticals is where I currently work. And my boss wrote the book Nexus of Care that I mentioned. But we're different in that we try to use our medications to bring clinical solutions to employers. Yes, we prescribe them or supply them with medications. We are a pharmacy benefit management company also. We actually have a TPA also. But our main role is to help employers understand their opportunity in this space. And that was probably my second biggest surprise, Harlan, is it's even though that healthcare is a huge portion of a company's budget, how little attention is paid by the C-suite to the healthcare spend. And I've had conversations with CEOs of companies, and I said, hey, I've heard that you don't pay attention to your healthcare spend like you do every other line item. And he said, yeah, that's pretty much true, because the system has worked perfectly to scare employers into not doing anything different. And to think that they can't do anything different, or it's too complex to do anything different, or the HRs are so overwhelmed and so overworked that they don't want to consider new systems because the additional work it'll cause them. So I think that was my second biggest surprise, as to how little attention is actually paid to the healthcare expenditure. And then just the fact that it doesn't surprise me, I guess, but still people don't want to change. That inertia to change is still so powerful, even though they have the opportunity to give so much a better benefit package to their people, and they do care about their people. You know, a couple of common themes is that there's a lot of bad brokers out there, and there's a lot of good brokers out there, but that most employers want to do the right thing by their people, yet still have this inability to accept that there's a different way. I think that's my second biggest surprise.
Yeah, I think you're very right. You know, I've been in this industry for a long time, but I wasn't always in the bigger employers. We always focused really small on the real small mom and pops, and we did very different things even with them. A lot of times, even non-insurance solutions. So as I have, in the last few years, as I've went into the bigger employer space, I was really shocked at some of the same things, Greg. I was really shocked at the pushback that you get from employers when you talk about anything different, when you talk about anything that doesn't include a card that has a major insurance company's name on it. Regardless of how good the benefits are and what else they're able to get, and even the fact that we can, of course, design plans that employees can get doctors, visits, even specialists, medications, surgeries, all of these things for zero cost. Even when you can design a plan where all of their health care is free, they still are hesitant to make that change. Even if they believe you. In other words, even if they say, yeah, I get it, this is awesome. But is it going to have this on the card? Well, no, it's not. But let me ask you a question. At the end of the day, why would it matter what it says on the card if the cost is zero? Right? Man, but I don't know. My people are going to freak out.
We've trained them, Harlan. We've trained them to be just like I want my patients to be active participants. I want the employers to be active participants in this space and to pay for healthcare services, not health insurance. And you've talked about this at length. There's a difference between healthcare and health insurance. The history of why these health insurance, why our system got this way. Back when the 40s, when the government wages were freezed and employers wanted to attract employers want to attract employees to their business. They did it by offering lucrative, benefits to their financial and their health benefit package. And then, of course, that snowballed into what we have today. But I guess, going back to what I said earlier about, I'm a little upset with my fellow physicians for not standing up and having a voice. The same thing with the large employers. They're perpetuating the system by continuing to hire the same old. And if they were to stand up and start making some changes in this industry and really trying to, the power of the United Employers and the power of United Physicians to have a voice in this space, I think we could truly make a huge difference as to how we pay for healthcare. And because it's kind of scary where we're at as far as how it's, as we've talked about this at length also, how it's crippling the average American, the healthcare costs. And,
right.
I've never necessarily been a big fan of universal coverage of healthcare, but the more and more I get into this, the more I realize that it's really unconscionable for us to be delivering healthcare in this way as a country. It just doesn't make any sense except for the people that are profiting off, which I know is a powerful incentive.
Yeah, and you know, it's interesting. You bring up universal health care, and I'm gonna give you kind of my slant on it here. I mean, it's already here. We already have universal health care in many different ways. I mean, that's what Medicare is, that's what Medicaid is, and that's what the Affordable Care Act is. The Affordable Care Act very much is set up on the design of universal care. When the government's paying any part of your health care, guess what? It's universal care, and they've done everything that they can to push more people that direction. I mean, we had this year 21 million people signed up for Affordable Care Act. That's, you know, it's about 10 million more than just about 3 or 4 years ago. So we've seen incredible growth in that, but it's a lot of the things that they have put in place that push people that direction. Now, the continued rising cost of healthcare obviously is a huge deal, but when you look at that $4.5 trillion that we spent last year, 4.5 trillion, that's a T, folks, $4.5 trillion that we spent on healthcare last year. A quarter of that is just simple administration. Now, that administration, of course, that is all because of the health insurance companies, right? That's all because of health insurance. That's all because of Medicare and Medicaid and all. There would be nothing really to administrate if we were really doing direct access to health care. If you didn't have that insurance piece, there's nothing to administrate. But on top of that, another quarter of that is fraud and waste. Well, that fraud and waste is there because of the insurance companies again, and Medicare and Medicaid. It's because of billing practices that take advantage of payments that are not authorized or shouldn't have been done, or prescriptions that were never taken. We see, it is amazing to me how many people still get prescriptions month after month that they're not taking, when you have other people that cannot afford to get the prescriptions that they need to take. It is amazing to me how often that this happens, and I hear stories about it.
Well, there's reasons for that, Harlan. That's why I never use the term non-compliant anymore, the phrase, because I don't think that's helpful. There's a reason why that person's not taking the medication. You know, if they can afford it, they don't trust the doctor, they don't see the need for it, they haven't been properly educated on the importance of taking it. And of course, we're all human. We sometimes just forget to take it or don't see the importance, but a good physician relationship or provider relationship with that individual can help them understand why they want to take it. I always like this, that motivation is getting people to do what you want them to do because they want to do it. Right. And you can't do that in a 7-minute office visit with somebody.
No, you're exactly right. But what we've seen in some cases, the people that are not taking medications because they switched to something else, but they had an order still going for this medication and they just didn't stop it. And one of the cases that we had recently was just mind-boggling because it was $6,000 a month medication that the employer is paying for, and the person hadn't taken it in 2 or 3 months. And they're still paying for that every single month. And the person is now, and what brought it to light is the fact now they're taking another medication that cost the same thing, but they're the same kinds of medication, right? You're like, wait a second, why are they taking these 2 medications?
Yeah.
Oh, they don't take this one anymore. Well, then why are we paying for it?
Yeah,
because they never stopped the mail order of it coming in. Yeah. It's just still coming in. Oh,
that's the advantage we have as a independent, smaller PBM, Harlan. Yeah. And we actually call it PSA, Pharmacy Service Administration. Is that we don't just automatically send refills out. We talk to people. We have 50% of our staff is clinical, so we make sure that waste. And in the GLP-1 world, what is it? 68% of people who start GLP-1 stop them eventually, and sometimes they keep getting shipped out, or they might even be diverting the medications. You never know, if they're not using them, they're not seeing the results. So you got to tie the medications in with the clinical outcomes for really the maximum impact.
Yeah, that's absolutely an interesting thing that you just said there, because when you don't track what's going on with your plan, this is what happens. And so this was a direct result of someone that was paying for these, and we were looking at their renewal. And so that's why we brought this up. It's like, well, why is this happening? This person shouldn't have been doing this. Well, this is a BUCA plan that they're paying themselves, right? Let's be honest. Who's the PBM? The PBM is owned by the same company that's got the insurance. This is what I think is really causing some people to take a second look at some of these big insurance companies when they own every single piece. and the only person they're paying is themselves, they're literally in a no-lose situation. If I own the physician, and if I own the PBM, and and I own the TPA, if I own every single piece of this plan, I'm rocking it, baby. This is awesome.
Yeah.
Look at me go.
Yeah.
That's a tough deal. But when you have an independent group like you guys, and I'll be honest with you, Greg, I'm not a big fan of too many people in a stack owning too many pieces. So the fact that you have a the TPA and a PBM, that raises some concern until you start thinking about the other side of it, saying, well, now this PBM has a pretty damn good reason to make sure that the prescriptions are regulated the right way. And as long as we're seeing, of course, the transparency, fiduciary, however you want to say it, those words don't mean a whole lot anymore. They do, but they are being put into ways that they don't really make any sense anymore. As long as that's being shared with the group and with, when we have the meetings for looking at data, then I can see that you're going to keep that. But this, one of the things that you guys have going against you, and is because we are seeing these big insurance companies do this, and man, this is the way to hide everything.
Right. Well, that goes against what our basic core values of being a good steward, and obviously that's not who we are, but employers should be suspicious about anybody who says they have all the solutions, all the answers, and we don't. We need partners. We need a good broker. We need advisors. But there's so many win-wins that are capable in this space, Harlan, instead of the win-lose. And ultimately, the system we have now, it's the individual that loses, the individual that gets stuck with the bill, the individual that is not allowed to be all they can be because they're burdened or not getting the proper service or care or consideration that they deserve.
So maybe I'm talking about something that you're not exactly not part of what you do. Let's put it this way with Northwind.
Yeah.
But you mentioned earlier GLP-1s.
Yes.
GLP-1s, a huge issue right now. It could, absolutely devastate health plans out there with employers not even realizing what's coming unless they've been educated. What are you guys doing? What kind of systems do you have in place to make sure that people that get those medications are getting them, but to make sure the people that should not be getting them are not getting them?
Well, thank you for the question, Harlan. We call it our clinical blueprints, and we have one specifically for diabetes and one specifically for obesity. And obviously, GLP-1s are a mainstay of treatment for both those conditions. We pair the pharmaceutical distribution and prescription with the medical outcomes. So we have, let's use obesity as an example. We have a whole stepwise approach. We have a formula that we use, and it doesn't include just GLP-1s. But the most important thing to do is we contact these members and try to understand where they're at, what their goals are. And we don't just give the medications we don't recommend employers just automatically let people have it who meet the criteria. We pair that with counseling. We pair that with pharmacy consultations. We follow the outcomes, the actual to see what the weight is. We see if they're using it. We talk about side effects. We handhold them through the whole process. So and then we can get into a philosophical discussion of whether obesity is a disease or not, or isn't. Clearly, it's a disease state, and clearly, it's an important problem. And clearly, these medications have a place, but these aren't indicated for people who are slightly overweight who want to lose 20 pounds so they get into a wedding dress or whatever. That's not what these medications are for. So I think you can't ignore this class. I think the furor is going to last for a while. Then it's going to lay down a little bit is when people realize that maybe it's not the final cure. But we have designed a program that allows people who qualify and meet certain criteria, who are active participants in the program, to have access to these medications. And so we are walking along employers to help them understand what they can do in this area. And it's more complicated than just approving it or not approving it. I think these medications have to have a place, but I think they also have to be put in their place, if that's the right to say it.
Yeah, and once again, I want to state that I wasn't really talking about an approval or non-approval. I was talking about appropriateness, and so that's the same thing you're talking about, is the appropriateness. Once again, the person that wants to lose 20 pounds to fit into a wedding dress, they may be in that overweight or obese place. Maybe by body structure, that's where they would fall. But if their intention is not a long-term solution, but to lose 20 pounds to fit into this wedding dress, that's not an appropriate medication for them, because they're not even looking at it as a long-term solution. I want to hit this thing for about 2 or 3 months so I can get into my wedding dress or get into my bridesmaid dress or whatever, and then I'm not going to use it anymore. That's not the solution. That's not it. Go get you a thing on Weight Watchers or whatever and change your eating habits and lose your 20 pounds that way, and then be happy to put it back on. But getting on a GLP-1, that's not appropriate, that you're causing that type of spend for your employer when you're not really looking at it as a long-term solution. That's really, and maybe I'm wrong. I mean, what is your thoughts on that then?
No, I think you're right on, Harlan. And also the point is that that medication is not getting into the hands of someone who does need it appropriately, because there still is limited supply also. Right. And let's be honest though. Let's be fair. It's hard to change the way we eat. And we can go into details as to why so many Americans are overweight or obese. Not the least of which is the food and drug industry that's really promoted low fat, and that carbs are incredibly addicting. And I get all that, but everyone has the ability to do something a little bit better in their life if they want to. And our goal is to walk alongside of them and help them along the way. So no, I think you're right. And you can make the argument, okay, what's the problem with someone losing 20 pounds to get into a wedding dress? So, maybe there isn't, but I think it's how do we use limited resources judiciously, and that is not what the purpose of those medications are for.
Right, and once again, these medications are actually, maybe I'm wrong, but they're designed for a long-term solution, not a quick fix. And
correct.
If all you're looking for is a quick fix, then I think there's other things out there that can probably give you that if you're not looking for a long term. And so the other side of that is, well, maybe, so what if this person is so happy that with the 20 pounds and that maybe they lost 32 instead, and they're so happy now they want to continue on this journey. So you're taking that opportunity away from them.
Yeah,
that's a valid argument. I get it. I understand. But if in the interview process, they don't indicate that, it's hard to say, well, this is what we're going to do. They're going to be so happy with this, then they're going to decide they want to make a long-term life change. Come on, let's be honest. It's very unlikely someone's going to change their eating habits, start exercising, and make a long-term life change if they don't go through the process of the counseling and the nutritionist and all of those things to know what's going to really be necessary to not just lose that weight, but to stay down that pathway. Because you mentioned it earlier, people quit. They stop taking them. When they stop taking them, if they haven't made lifestyle changes, it's going to be like every other thing they've ever done, and the weight's coming back.
There was a interesting talk I listened to, and I think they said 50% of people who were in Vietnam did drugs while they were in Vietnam. And when they got discharged back home, only 5% of people stayed hooked on the drugs. What's the difference? It's the toxic environment. They went out of a toxic environment and came back to a healthy environment. They didn't need the drugs anymore. So if you, and in my experience too, Harlan, is that, well, if I can just lose that first 20 pounds, I can do the rest on my own. Not if you're in the same toxic environment, the same life, the same stress, it doesn't work that way. And that's why I challenge people. That's why I ask them, what's going on in your life? What's going good in your life? And what do you need to improve in your life, not your health? Because someone who is, and we could talk about what is the definition of health? What does it really mean to be healthy? Because I have some strong views on that. But it's not as simple as, well, I just need to eat right and exercise more and do all those kind of things. If your life is totally out of order, if you're in disarray, if you have tremendous stresses, if you don't like your job, if your relationships aren't good, those are things that have to be addressed. And those are the things that only individuals have the power, really, with some help, to overcome. And so when I approach someone as a patient, I look at the whole picture. You can't separate their physical, emotional, psychological, financial health from their physical health. It doesn't work that way. So you have to look at the whole person.
No, absolutely. We've preached this for years and years. It's all part of that holistic. It's your physical, it's your mental, and unfortunately, in the world, the culture we live in, it's your financial. Because any one of those parts of the three-legged stool, you're coming down, and the other two are going to be not far behind it. That's just unfortunately the way that as Americans that we are. It's just built into us, and it's unfortunate, but that's the way it is. I'm going to ask one more thing around GLP-1s, and it's a little early, so you guys probably haven't addressed it yet. But from the time that we're taping right now, on March the 8th, which was very recently, the FDA approved Wegovy for cardiological, easy for me to say, cardiological indicators. What impact do you think that's going to have on even PBMs, I guess you can say, on that particular medication as a solution, and more people requesting it, especially if they have any of those indicators that were listed there? It's kind of a loophole, right? As well, I've got declined on this before because my employer doesn't do obesity. They don't do weight control, but I've got this heart murmur from when I was a little kid, and so now I need Wegovy.
Well, I think it was indicated for people who have known cardiovascular disease, who have diabetes or obesity, and they qualify in other ways. Interesting also, Harlan, I think there's some good indications for the GLP-1s for addiction treatments, for eating disorders. There's actually, it kind of seems to hit that dopamine reward center of your brain that makes those things less enjoyable, even for alcoholism. So there may be some fascinating uses of GLP-1s going forward. But as far as the data I looked at for heart disease wasn't as compelling as I think the media seems to imply. And we know that people who have diabetes are higher risk for macular vascular disease, blocked arteries. We know that because the five big risk factors for heart disease, Harlan, are smoking, diabetes, high blood pressure, high cholesterol, and family history. And so we know if you have diabetes, and likely if you have diabetes, you have problems with your cholesterol or triglycerides. We know you're increased risk. So I think in that situation, that could be a really bona fide use, and maybe even at lower doses that are given for people who are trying to lose weight. So I think there is definitely a place for those in those indications. But again, I just have a real problem with this medication being advertised as a panacea for every condition that's out there, because it's not.
No, and I hear you. And I of course I probably didn't read near the full report that you did, but the data over a 5-year period showed like a 20% decrease in a variety of things on the cardiovascular indicators. That's a number of different things, but you're right. It's 4 or 5 different particular. I said a heart murmur. That wasn't one of them, folks. So don't go out there if you got a heart murmur thinking you're gonna get Wegovy now. I don't remember what all they are. I don't have my notes pulled up or anything. Since we got to this part of the conversation, which I had no idea we were going to get to, I thought I would bring it up because that is something that's a fairly new thing. And once again, I would have figured that you guys wouldn't have anything in place yet because it is so new. But it's something now that, of course, you've got to look at. Anytime the FDA waves their wand and says this is approved for that, then you're going to have people that say, I want it for that.
When the GLP-1s first came out, Harlan, years ago, I actually thought it should be first-line treatment for diabetes because of the way it works. Some of the older medications for diabetes, long ago, they were called sulfonylureas. All they did was try to whip your pancreas to produce more insulin. And they didn't have good outcomes. It was just a way to lower the number. But ultimately, you don't want a medication that lowers your cholesterol or lowers your sugar. You want a medication that prevents you from having complications from having blocked arteries, because you're only as old as your arteries, Harlan. You want to keep your arteries as healthy as possible. The areas that have great blood supply, they do well. If you've got a cut on your scalp, it bleeds like crazy, but almost never gets infected because it's got great blood supply. Where other parts of your body, aren't that, it's not the same way. And so if you get infection there, they're hard to clear up. So there is definitely a place for these medications going forward for maybe for these other conditions too. But it goes back to that word responsibility, which I think every individual is responsible for their own health. But Harlan, it's not just a duty, it's an opportunity. Every person has the opportunity to become better in some way in their life and then subsequent in their health. And we talked a little briefly before we came on, about the 3 keys to living a long life, in my opinion, are a spirit of gratefulness, a love of learning new things, and loving relationships. If you have those things in your life, that's where the secret is. And there's studies out there from the Blue Zone work. There's studies out there from the Harvard longitudinal study, the longest study on human behavior in life, that you want to live a long life, have good relationships. That is the key to a long life. And I would like to think that anything that we do in healthcare, if we use the litmus test, does this improve relationships? Because I believe the definition of health is not longevity. It's not the absence of disease. I think the definition of health is the ability to be in relationship. And if we focus on that and everything that we bring, the solutions that we bring, maybe we wouldn't be so gung-ho with AI. Does AI improve relationships? Let's not get off on that tangent, but is anything we're doing in healthcare, does it improve our ability as a person to be in a relationship? And I think that would be a good litmus test to use as we develop these new techniques and new medications. And again, I'm not against new innovations and new medications, but I am against looking to those things as the savior for all of our problems, when really the power is within all of us to improve our situation in life.
I think that's a very valid point. And, we did talk about that early. And I said, if you have those three things, then you're much more likely to take care of yourself anyway, because if you have good quality relationships, you don't want to lose those, right? You don't want to disappoint people by not being around, as it were. So you're more likely to take care of yourself. That's going to give you better health. And I agree with you 100% that relationships are vitally important. But along those lines, I'm going to ask you a question then, as a physician. Mm-hmm. In your years, which you had lots of years taking care of folks, how often did you run into people that through your questioning, through your interaction with them, with your relationship with them, did you find out that your relationship may be the only one that they had?
It wasn't infrequent. I mean, you used to be surprised sometimes that how people would tell you and they would go on, but then you realize they didn't have a whole lot in their life. There was a story in my office, Harlan, that a man came in. He was the most grumpy, miserable man that you'd ever want to meet. And one of our nurses took on herself to try to break him, right? And so she went her way to be nice to him. And he was just surly and grumpy. And finally, she said something that resonated with him. And he started sending her flowers once a week for the rest of his life. He can send her flowers because of that simple. He acknowledged it, because everyone that's grumpy, Harlan, there's a reason why they're grumpy. Everyone right. Who seems to be a jerk, there's something in their background that is not right, and they're struggling. And yes, there are narcissists, there are antisocial personalities and people but most people who are having a bad day, there's a reason why they have a bad day. And we can either give them grace and mercy and try to understand them with compassion and love, or we can judge them, which we're so good at, taking one aspect. Yeah. So I've been divorced now for 12 years, Harlan, and I go on dating sites. You hear us. Well, if you voted for this guy, don't bother. Or if you vote for this person, don't bother. And you think, okay, you're going to judge me entirely by one aspect of my life. We do that so often, that we judge people based on one quick meeting and one quick observance, and we don't know what's going through that life and through the struggle through that person. And I think having that grace and mercy is a lot. So to answer your question, it happened frequently, but I would really try to encourage those people to look and see what's going on that's good, because sometimes we focus on all that's bad, and sometimes the relationships are there. And I read this once before too. He said, when you're 8 years old, if you have one person in your life that you can call at 3 a.m. with any problem that you had, and they would totally be there for you in every step of the way, then you're a pretty lucky person. So it's not necessarily how many relationships you have too, it's the quality of the ones that you have. You don't need 50 relationships. And of course, we know that friends on Facebook is not a measure of how deep your relationships are.
It certainly ain't. Your number of friends on Facebook or your number of connections on LinkedIn are not an indicator of your relationships and happiness. That is absolutely true. I think it's interesting you said that. I've noticed this, and I can't speak for you, but I've noticed that as I've got older, my circle of friends has got much smaller. People that I truly call friends. I've got more acquaintances right now than I probably ever had since high school, but they're acquaintances. It's not friends, right? And it's not people that circle has become tighter and tighter, as my wife would probably laugh at this, as my wisdom of who I allow in my life and to have depth in my life has changed who I allow to be in that circle, as it were. And so I think that's interesting. As you go through life, you're not really as worried about bad influences in your 20s as you should be.
Yeah.
but as you go through, all of a sudden it becomes a bigger deal. I personally believe that it becomes a bigger deal, or it should. I don't think it does for everybody, and so there's a whole different story there. But if you mature and you gain wisdom, I think you allow fewer people to be there, for good or bad. I think for some folks that's for me, that's just the way that I deal with that.
Yeah.
And so it's very hard to get in that circle, right? It's very hard for someone now, when I'm 57 years old, it's very difficult for someone to get in my circle. But it's the ones that do, I may not talk to for a year. And when we do, it's just like we were just talking to each other the day before.
Well, a couple of beautiful things happen as you get older, Harlan. Number one is you don't care as much about what people think of you. But the other one is you don't have to be right as you get older. You don't have to prove yourself so much. Your ego kind of takes a back seat, and so you don't need to hang around people to prove how right you are, how cool you are.
Yeah.
Albert Brooks wrote a great book called From Strength to Strength, and he talks about when we're younger, we have something called fluid intelligence. We think quickly, we process quickly, we are creative, our math in our head. But we start losing that in our late 20s and 30s. But luckily, what we gain is then called crystallized intelligence, which basically is the sum of your experiences, the knowledge and hopefully the wisdom you have to apply it. And so when you don't have to please everybody, you don't have to be right, then you'll naturally be attracted to those people that you're truly that want to be vulnerable with you, that are authentic with you. You know, those are two words that come to me when I think about true friends, where you don't have to pretend that you're someone else. And again, that's just a beautiful place to be, to have those kind of relationships.
Yeah, it really is. I'm gonna say this because I think it's kind of interesting. You talked earlier about, as a doctor, of course, this is not surprising to people out there, that people told you things for your career that you're like, I didn't even need to know that. That has nothing to do with anything, right? They just told you things. And once again, because you're a physician, whatever was going on in their life probably did matter to their health. And so they did tell you things that maybe would have mattered, but they probably also told you things that you're like, yeah, I didn't need to hear that. Well, I think the interesting thing is, as an insurance guy, people tell me stuff. I just like, that has nothing to do with kind of policy you go and get there, Jack. I don't know why you told me that, but okay. And I was told by someone that had nothing to do with me being an insurance person. It had to do with people felt like they could trust me and tell me things. And I'm like, well, okay, I don't know if that makes me feel much better, but all right. But I think that has something to do with it too, with you, because they did trust you. Right? They trusted you. It doesn't matter that you were a doctor, because people lie to their doctors all the time. And many times the way they lie to them is
they did? They lied to
withholding. But though they withhold, they don't tell them everything, right? They don't tell them everything. And there's something they might not have told you that could have completely changed the way that you would have approached a diagnosis, or the way you would have approached a treatment, or the way you would have approached even your advice on what to tell them, because they left out one little thing like, yeah, he doesn't need to know that my foot falls asleep most of the day, every single day. Wait, what?
Yeah.
Or when I sleep at night, my hand burns and my arm burns up and down all night long, and I have a hard time sleeping because my arm's burning.
Yeah.
What? Well, why didn't you tell him that?
Well, part of the reason, Harlan, is just lack of time. I can't tell you how many times in my last role, I had patients say after 20, 25 minutes of me talking, saying, I feel comfortable with you enough to tell you this now. Yes. Whereas in that 7 to 10 minute visit, you don't get that. And then when you're genuinely, I learned this through a communication class years ago, Harlan. If you ask people what's the number one secret to good communication, most people would answer, you have to be a good listener. And I would say that's number two. I'd say number one is you really have to want to connect the other person. You have to really want to hear what they have to say. And people know that. They can tell when you're genuinely interested. So when I would see someone come in and have a shirt with a slogan on it, I'd ask them about it. It's to be genuinely curious. And when you get that, I think the two people that should have psychology degrees are hairdressers and bartenders, because they hear more stuff from people than anybody. So maybe we'll add brokers in there now too. But it goes back to I don't know, maybe people trust you, you're trusting them with your hair, or sharp scissors around your head. Maybe that gives you trust right away. Or, being around people who want to listen, who are genuinely interested, who are curious, Harlan, the secret to life is not in the answers, it's in the questions. You want to be an interesting person,
Sure.
ask interesting questions. And just like in your podcast, you've gotten to learn from so many different people because you ask interesting questions. And that's where life is at. It's that question relationship, being open to new ideas, to realizing you're not right, that you're probably wrong anyways. And you can learn from the other person. It's just a beautiful place to be.
No, it really is. I think once again, you gain wisdom. I truly used to believe that I was always right. I mean, that's it, right? That's a guy thing. But I've been married for 32 years now, and now I realize I'm very rarely right. I'm almost always wrong, and that's okay. I've accepted that. Right? I've accepted the fact that I'm wrong, and that's okay. I only made really one good decision, and that's who I married. The folks that know my wife know that I married very well because she keeps me in line, she keeps me grounded, and hey, she keeps everything organized around here. It's really funny. I'll go to different events, and all of a sudden I'm doing my commercial, and then someone talks about start talking about my wife, and then all these other people are like, "Oh yeah, Kelly's great. She did this. She helped me. She talked to me." And I'm like, "Well, but look, here I am. I'm right here. She's not even here. Why do we got to talk about it right now? Why can't this be my time?"
Well, they're smarter than we are, Harlan, and that's one of the reasons why
Yes.
they live on average 6 years longer than us across the world. Have you ever thought about that? You ever thought about why women live longer than men? I mean, some of it's obvious. Number one is they don't kill themselves in stupid ways when they're younger.
Right.
You never heard Marge say to Betty, "Here, hold my beer and watch this."
Exactly. Exactly.
Number two, they're more dangerous occupations, generally speaking, and more physically taxing occupations. And they're more relational. They talk more about issues. They get it intuitively that a shared sorrow is a sorrow halved. A shared joy is a joy doubled. They get that. But one of the main reasons is they're smaller. They're just smaller people, and smaller people tend to live longer than taller, heavier people, and that's a fact. But it's crazy. But places like the blue zones in the world where men live as long as women do, they have high percentage of people over 100 compared to the rest of the world's population. It goes back to that they're engaged in conversation. Their life's built around motion. They eat about 85% full, but they have things to do. They have purpose. In Okinawa, they call it ikigai. In Costa Rica, they call it plan de vida. They have reasons to get out of bed in the morning. And then they just talk and they drink some wine and they laugh and they're in that relationship with each other. And we've gotten away from that. And the porches used to be built in the front yard. Now they're built in the backyard. And we just don't invite people over to a barbecue. And I'm still waiting for that invite, by the way, Harlan. So one of your barbecues, but it all relates to what I do as a physician and what I'm doing now in my new role, because it's still. My goal isn't to tell employers that they're idiots and they're going to be crazy if they don't change things. That's not going to influence anybody. But to show them that I'm a trusted partner, that I care about them and as they care about their people, and to get in a position where they earn your trust, which isn't easy in this world. That's kind of where I think where I want to head with my new role.
Well, okay. So all of those things are easy to say. What's it going to take? What's it really going to take? Start moving the needle, because I was shocked whenever I heard these numbers. Doing the advisor kind of thought process that I have, and that the Rosetta guys have, and the next gen guys have, and even some that don't even know about that, but they kind of do it on their own, right? They've kind of done it.
Right.
There's less than 500 of us in the country, and then companies that have made the wholesale change to do the full model switch, less than 1%, or right at 1% in the entire country. That's right. Crazy. That's crazy, Greg. What's it going to take to move the needle, brother?
Well, on an individual basis, you go back to what Covey teaches. Trust is character plus competence. You have to have high character. You have to be competent, and you have to do what you're going to say you're going to do, but you have to get in the door. And so one of the approaches I've taken is I've joined SHRM, the Society of Human Resource Management. HR people care about their employees, and I want to support them any way I can. So somehow you've got to get your word out there. Harlan, what you're doing, spreading the message, people hearing that there's a different way. But ultimately, it goes back to meeting people, talking to them, showing curiosity, trying to understand what their needs are. and not coming across a typical salesman like the pharmaceutical reps of years ago. Can I count on you for my next 10 scripts now that I've given you this great information? These standard sales techniques, those don't work. It's a matter of trust. And we'd like to use, the transparency words being thrown around a lot nowadays. We're transparent this, transparent that. But I think it's more about trust. I think it's getting to a position where, and sometimes as simple as playing golf with somebody. You want to know if you trust somebody? Play 18 holes of golf with somebody. You have a great idea because you can't hide yourself on a golf course. It's a great review character. If they cheat on the golf course, I'm telling you, they're going to cheat elsewhere in their life. But it's just a matter of getting the word out and getting in front of people. And really, and I love this ad, like these rappers that are getting on and talking about price transparency. That's a movement. What if physicians were to stand up and saying, we've been part of this healthcare system that doesn't work for everybody. Here's what we're going to do. We're going to accept direct contracts. We're going to go with employers and directly work with them to provide our services to them. And we're going to try to cut out the middlemen. That's, a fantasy wish of mine, but there's some physician organizations that are coming up that are starting to do some of those things. And so I think it's brokers like you, it's the Nelson Griswolds of the world, it's the Dave Chases of the world, it's David Conternos of the world, it's the Harlan Pickett's of the world who are spreading the message and getting it out there. I think on LinkedIn, we just preach to each other. I'm not sure how effective that is, although occasionally you come across somebody. But I think it's getting into the weeds and doing the work. You didn't get to where you are now, Harlan, by sitting back and hoping someone knocks on your door and asking for your services. You've done so many unique things to get the word out. And I think we have to do that. But I'm open for your suggestions also as to how we can move the needle.
But I think my number one goal, okay? People would say, oh, it's to grow your company, it's to make all this money. That'd be awesome. But that's not my number one goal. My number one goal is to promote what we're doing. And so it's to promote any of those 500 brokers out there that are doing things differently and helping employers move and get away from status quo. It's promoting folks like Northwind that are doing things differently, that are helping employers change from the status quo. It is promoting Nelson and Dave and all the rest of what we're doing to make sure employers have just the opportunity to hear about it, just a little bit of curiosity. One of the things that I've said multiple times on all the different platforms I go to, if you don't want to work with me, that's fine. Let me introduce you to somebody.
Love that. I love that.
In your area that you can work with. If you're in Wisconsin, let me introduce you to Matt Ort.
Yeah.
You're not going to find a better person to talk to than Matt Ort in Wisconsin. He's got the connections. He's got, the whole thing is in place. He's got it going on there. You want to talk to someone who has been in the battles with the employee that has actually been on the dark side of working for an employer and knows how to do things the right way, and you're in Illinois, let me introduce you to Terry Shook. Terry Shook can help you walk through this and help you engage in that battle. You're in Louisiana and you're looking for someone to work with, let me introduce you to Jen Hearn. Jen's going to help you understand how to move this in the right direction. It goes across the board. I know people all over the country that can help you in different places. Okay. And I can introduce you to employers that have already made the change. These are the same things you can do too, Greg. It's getting the word out that there is a way to do things differently. And I promise you, folks, there's someone in your backyard that's doing it. Absolutely. If you're out there today and you're saying, but who? You're in Texas. You can't help me over here in Rhode Island. Well, I can, but if you don't want to work with me, I can get somebody up there that can work with you. I can introduce someone that's close to you. Okay. You're in the Boston area. Let me introduce you to Dr. Jeffrey Gold. He has a DPC right there outside of Boston. I'm sure he'd be happy to talk to you. I'm sure he has brokers that he works with that get it, that are right there close to him. We're all over the country now. There's not a lot of us, but we're all over the country now and we can help you. And I think that's what's important, is promoting the movement more than anything else and letting people know that there's answers and solutions out there. You don't just have to choose because you saw a guy on LinkedIn. You don't have to work with him. He can get you to somebody, or all of us, because I don't believe that we're in competition. That's the big thing. We're not in competition. We're all here to support one another.
That's a great point, Harlan. I never felt I was in competition with a family doc down the road because there was always plenty of business to go along. And in fact, we'd be the first person to help each other out if we had a question, even though we were on separate payrolls. But as you know, in fairness to the brokers, a lot of them have been ignorant maybe about the importance of the role and the situation, and they're waking up and they're seeing it. So ignorance is a defense for so long, but now that you know, if you keep on that road, then you're just being stupid. Now, I've asked this question many times, you know, is appealing to an employer's sense of their fiduciary and stewardship responsibility. And I separate the two, is whereas fiduciary is more about the money, stewardship is more about the moral and the ethics. Do they realize that the role they have in helping take care of people who devote much of their lives to their business? You know, what is your role? And so I use that, but I also know you have to bring an economic solution too. You can't just say it's the right thing. You have to say it's the right thing and you're going to save money also. And I understand the money motivates people. I understand how the world works. I'm not naive, Harlan, but I guess maybe I'm still a little bit of a dreamer, still saying that I still think love is the most powerful force in the universe. And one of our core values is leave it better than when you found it. And that just means you want the other person to be better off because they worked with you. And I don't think that's pie in the sky. I don't think that's too much to ask.
No, I agree with you. And you know, that's, by the way, folks, leave it better than how you found it. Always do that unless it's a gate. If it's a gate on property, leave it like you found it. Okay. For those of you in Texas, you understand what I'm talking about. If the gate was open, you leave the gate open. If the gate was closed, you close the daggone thing behind you, but don't change anything because you're just going to anger whoever's gate that actually was. All right. Sorry. I don't know why this is the way my crazy mind works, Greg. When you said that, I'm like, except for a gate. Except for a gate. You can't leave it better when you found it when it was a gate, because if you start messing with someone's gate, they get angry. So anyway. So you talked a little bit in our previous conversation about how you believe that a company's culture can really determine a lot of the way they look at these things, the way that they look at status quo, or the way that they are more acceptable to change, even more understanding of it's not just change for change's sake, but it's change for better. In other words, let's be honest, sometimes when you switch to one of these plans, there's no immediate cost savings, but there will be. And you know, it's proven out that there will be over time, as long as the engagement is right. Yeah, I mean, we go through all the details there. But talk about culture, talk about company culture, because obviously you worked as a physician at a big company, but it wasn't just that. You also were in a family practice where I'm sure there was a lot of people that you dealt with that worked for a company. So you got to hear about company cultures being both positive and negative. So give us a little insight on that.
Well, I got to experience it too, Harlan. I always took my two roles as a practicing physician and as a leader in my office. Number one, were to help my patient understand their responsibility to take care of themselves. And number two, we take care of each other. If we take care of each other, we'll take care of our patients. And so I always consider myself the chief culture officer at my previous practice. And in a small office of 15 people, we had one employee that we hired who was that passive taker. You never realized they were like it, but they stirred up the pot every chance they got. And it changed the culture almost overnight to one of bickering and backstabbing. And why is she doing this? And I don't get to do this. But if you bring a great solution to an employer, and the culture is that there's no communication, and the employers are going to roll their eyes and say, forget it. I'm not in on this. You've got to spend time taking care of people. Bob Chapman wrote a book called Everybody Matters. And he took over companies, and during downturns, he didn't lay anybody off. He found ways, creative ways to keep everybody employed. Some people, he asked them if they want to take a voluntary leave of absence, you know, and not get paid for a few months. He found creative solutions. But if your modus operandi is as soon as the market goes down, you lay off a bunch of people, boy, it's hard to say you have a caring culture. And I understand there's definite reasons why people get laid off. Right. But I think that once you have a culture where people care for each other and you feel cared for with each other, you're more likely to be engaged in that company, and then you're more likely to listen to any changes that come through the door. So I think one of the first steps you have to do when you're evaluating your benefit packages is look at your culture. There are companies. There's a company called Instill that's out there. I don't know if you've ever heard of them, Harlan, but they're relatively new, but they go look at it and evaluate your culture for you. They'll actually give you a score on your culture and find ways to improve it. It's kind of like Dave Chase's score of the health insurance plans. So I just think that if you're trying to make a huge change in your healthcare benefits, but your culture is poor and people don't care what you think, they can't trust you because you haven't followed through. You do surveys every year and you ask for suggestions and nothing changes, then you're much less likely to be successful with the healthcare benefit change.
No, I agree with you. I also believe that many times the culture is whatever it is because there's not a clear definition of what the company's values are to begin with. And if you've got it on your website and that's about as far as it goes, well, that's about as far as it goes then, folks, because your employees probably don't spend too much time on your company's website. It's amazing to me how many people could not tell you what their company's values are or why their company does what they do. They don't even know the why.
Yeah.
That's people who just have a job.
Yep.
They just have a job. Why do people switch jobs all the time? Yes, I know the younger generation is a lot about switching jobs all the place. That's because they have not found a place that gives them the fulfillment. They haven't found a place that meets their why. And they want to matter. That is one thing I'll say about the younger generation. I mean, I've got a couple of kids that kind of fit in that. They want to matter. They want to do something that matters in this world. And when they feel like, once again, I filled out the survey and nothing changed, I'm moving on.
Right.
Until they find a place where what they're doing matters.
Yeah.
That's a big deal. And I don't think there's a bigger place that companies can show their employees that they matter than putting in benefits that are actually beneficial.
Yeah, I agree with you. You know, Elizabeth Gilbert wrote the book Eat, Pray, Love, and she talked about you can have a hobby, you can have a job, you can have a career, you can have a vocation. There's nothing wrong with having a job. In fact, you can have a right to fail at your job, but you don't have a right to cause other people to fail at their job because you didn't do your job. And it goes back to my famous football coach that I love, Lou Holtz. He said, you know, people talk about success. He said, but I'd rather be significant. And significance is when you make other people successful. So if you are in a culture where the person next to you wants what's best for you and wants you to succeed and is doing everything they can to help you out, not only is that good for your company and good for your bottom line, it's good for you as an individual who's helping somebody else. Because we all know you get more, and I know this is kind of a cliche, but you get more when you give than you do when you receive. You know that. And really what's truly best for someone else is a really nice place to be also.
It really is. And if you are one of those brokers out there that is, you know, just hearing a lot of these things, or you've been hearing these things for a long time, and maybe you haven't made that switch, or maybe you're new to hear these things and you haven't made that change, let me just tell you what a extreme joy it is to make these changes and see the impact that you make on these groups, and to get the little notes and get the cards like you were talking about you got from your patients whenever you left.
Yeah.
To see people and it makes a true impact in their lives, and you're leaving that better than way you found it. Back to what you said earlier, you're leaving this group now better than what you found them. And and I don't mean leave them as in, yeah, I've done my work here and I'm moving on. I mean, you found them in this place, and now as you leave them to pursue other groups, but they're still with you, you're leaving them better off than what you found them, because you put them in a place not just to save money, but to receive better health care, to receive better outcomes, to have healthier, happier employees, to put themselves in a better position in their market to attract and retain quality employees. And man, I'll tell you, in this market across the country, I don't care what industry you're in, that is the most paramount thing that's out there right now. A recent survey, 100%, when does 100% of anybody, 172 employers were surveyed in this, and all 172 said that attract and retain employees is the main thing, and that the cost of healthcare and access to healthcare is a big factor towards that right now, with 81% of them saying it is the main factor.
And I love that. And it's so hard for HR people to have I went to a meeting yesterday of SHRM and the responsibilities that HR has in a company. It's just, the list is so long, but one of them is to try to keep their people happy. And so we're often asked when we bring our solutions to bear, what's the ROI on your thing? And I said, well, here's the ROI. Here's how I think we can save you money. But I'll tell you one thing we'll guarantee. You're going to get employees that go into your HR office and thank you for bringing our solution to you. You're going to get thank yous from us is what you're going to get. And someone said, well, we never get thanked in HR. All they hear is complaints. But when you generally take care of your people, you said they recognize, and people don't want to move in a place where they feel cared for.
No, you're exactly right. That's such an interesting comment, because most HR people said no one walks into my office to say thank you. No one walks into my office without a problem. They walk into my office with a problem. Right? Whatever it is, they walk into my office and they've got a problem.
We carve the diabetes spend out of an employer's plan, and they get the medications for free, and they get the CGMs for free, and they don't have to worry about next paycheck as to how they're going to afford the diabetes medication. They're going to walk into your office and thank you.
They're going to walk in your office and be happy with it. They're going to walk in the office with a smile on their face, and not a problem, but a very graciousness for the solution that you brought them. Because, hey, just like you get to be the GOAT in HR, you also get to be the hero. So if you're an HR individual out there, the old adage of no one gets fired for signing up for Blue Cross, no one gets fired for signing up for United, and so that's why it's easy to go with the status quo. While that is true, you'll never be the hero. You'll never, ever be the hero, and you'll still have people coming in complaining. You'll still have people coming in because they can't afford their medications. They can't afford their test strips. They can't afford, whatever it is, they can't afford it. But when you have these type of solutions, how much does it cost for that, Greg?
0 times 0, which
zero times zero. I'm a little old to be doing math, but I'm pretty sure that anything
0 divided by 0 then
are divided by 0. It's 0. I'm pretty sure that's 0 then, folks. So what Greg just said is, through their program, that the care of diabetes is 0 out of pocket. I don't think you're going to have too many people then that don't get that taken care of, which we know is a huge problem in this country right now, because there's a lot of uncontrolled diabetes out there. I want to go back to something from earlier. I know this is just completely random, folks, and that's okay, because it's my show. I do what I want to.
You sound like Monty Python for something completely different. Okay.
Sure, now for something completely different. So you talked earlier about why the scalp heals so quickly, right? The scalp heals quickly because it's close to the blood supply, right? It's
right. Great blood supply, yeah.
So we never hear too much about someone with diabetes that has problem with a scalp wound not hearing, but we do hear about feet wounds not here. So that's why, right? It's because it's so far away from the blood supply.
That's correct.
That's a contributing factor.
It's a blood supply problem. Yep. All the complications of diabetes are related to blood supply, to blocked arteries, from hardening of the arteries. So your treatment for diabetes is not to lower the blood sugar, it's to prevent arteries from hardening. That's why you treat diabetes.
So the folks out there that have feet wounds, it's because their feet's so far away. Come on, folks. It's science.
Yeah. Now you're blinding me with science, Harlan. So
no, we started going another direction. We went for to your 3 things of life right after we talked about that, and it just kind of struck me for a second that I've had a lot of people, literally, I'm not a clinician, this will tell you, I've had a lot of people ask me, why is it that people with diabetes always have issue with feet problems? They always have feet problems. I really had no idea why. I really didn't.
The circulation also affects the nerves, Harlan. And when the nerves go numb, you can't tell you have a sore. And then it's too late. But it all goes back to the circulation issue.
Yeah. No, it makes perfect sense. When you said it, I'm like, well, there you go. There's the answer. The answer is they're way down yonder, right? They're so far away from the blood flow that the circulation to get there is what's causing the issue, which I'm assuming also that's the reason why they have swelling. I mean, you can almost look at someone's legs in many cases and say they have diabetes.
Yeah. And it's never too late to make a change, a positive change in your life. It's sometimes overwhelming about, we have to do this to improve our health. We got to do this. We got to do this. We got to do this. Start somewhere, start somewhere, because I do believe, and Jordan Peterson has said this, he thinks the secret to the problem with humanity is for the individual to try to be better than they used to be. Just try somewhere in your life to make a positive change. And I did have a guy once too, Harlan, I tried different ways to motivate people, but I said to him, are you giving your family the best you? And he started crying right there on the spot. And he said, no, I'm not. But self-compassion and self-forgiveness too, because we are a product of our past experiences and what we believe, but we all have the ability to take better care of ourselves. And employers, you have the ability to take care of your people better. And is it easy? No. Is it hard work? Yes.
Yeah.
But when you truly help other person, or when you have that goal to help someone else, that's a powerful motivator too. And you said, and I love what you said about brokers. When you do the right thing, boy, it feels good.
It sure does.
Because and that never goes out of style.
It really doesn't. If you're a traditional broker right now, the only person who sends you a thank you card is whoever you took to play golf or took to dinner. Yeah. If you get one at all, right? They certainly are not saying thank you for this awesome plan. It saved us all this money and the employees all love it. Yeah. Why? Ask yourself why. Why aren't you getting those results? And the bottom line is you're not going to get happy, joyful people on a traditional insurance plan. You're just not going to. Now, I'm going to say this. This is a caveat. That doesn't mean every group should be in a non-traditional plan. There are some groups that need to be in a traditional because of things that are going on. But it doesn't mean you cannot bring in point solutions, different things like direct primary care, different things like some pharmacy changes that can be bolted on to these plans to provide the employer better outcomes for their employees, cost savings. Even if they're in a traditional sense, there's many times you can bolt these things on to help them. If you don't know about those, then please reach out to me. Okay, you can find me on LinkedIn very easily, and I'll be happy to introduce you to some of the folks that we work with. Be happy to give you a direct introduction to Gregg too, if you're ready to work with some of those, because prescription drugs is one of the biggest places people can make a huge impact. And I know you guys have helped lots of companies do that. You don't have to be there in a plan. You can be a bolt-on that can make a difference to a company as well.
Appreciate it, Harlan. And I'm, if the advisors, the brokers, the producers, however you want to call it, which is another thing I learned about the different names. If your job is that important, you deserve to be paid well for what you do. Yeah. And so I'm not saying that you don't deserve to be paid well. Right. But your fees, your commissions, and you still get commissions. That's okay too. Just disclose what you're getting, but understand. I had a broker last week, Harlan, tell me that he got a check for $80,000 from one of the Bucas once, and he called us. What's this for? And he said, well, it's because you gave us business, blah, blah. I said, I can't cash this. I didn't do anything for it. And that gives me hope that there is still people that say, it's not just about the money. It's about doing the right thing too.
Yeah, absolutely. Well, Gregg, I really appreciate the time that you spent with us today. It has been very enlightening. I know you have a great heart for this. I'm sad for your patients that you stepped away from family practice, but I am super happy for the movement that you stepped away from your practice to really be able to engage with more folks and make a bigger impact in this industry. Because I've said this before, Gregg, I don't know how you feel about this, but I don't think we can fix our healthcare system. And I don't think we can I'm not even going to try. What David is all about, what many of us are all about, are building a parallel healthcare system that works the way it should have worked. It's patient-centric, so it revolves around the patient, not around an insurance company or around a hospital or around a doctor's practice. It revolves around the patient that actually provides the care that they deserve at the time, at the place that they deserve it. And I think if we can do that, and the folks from the other side see what we're doing, they're going to want more of this. So we've got to get those pieces in places in part, those parts in place, get more people going down this pathway so it becomes a bright enough light that folks on the other side can see it and want some more of it. And I think that'll help us draw employers over here as well.
Harlan, I really appreciate the opportunity to speak with you today. And again, obviously we're like-minded. And I go back to something you said earlier, there's camaraderie in this space. We're not competing against each other as much as we're trying to help each other succeed and ultimately help the individual succeed. And so I think we need to keep harp on that message too. There's plenty of business to go around for everybody. Let's help each other out. And like you said, wasn't everybody's cup of tea, Harlan. But I did cry with my patients when I left. I mean, that was hard. It was really, really hard because it was the depth of that relationship. But when I left last July, Harlan, overwhelmed with emotion, and it was gratitude that came to the surface more than anything else. The opportunity I had to help people on a daily basis was just phenomenal. And yeah, I do miss that part of it. But I don't miss being called at 2 a.m. to deliver a baby anymore. I'm okay not having that responsibility anymore. But sometimes I wonder, did I make the right move? Because this space is complicated, it's difficult. But then, one person at a time, one individual at a time, one employer at a time. We can't blow up the system the way it is, but we definitely can make inroads on it, and we already have. And the movements, the train's rolling, and it's left the station.
There you go. Absolutely. All right. Thanks again, Gregg, for being with us. Best of wishes on your journey now. I certainly believe we'll be able to work together on some stuff in the future as well. So I really do appreciate getting to know you over the last few months, and it's a pleasure to have you on this journey, because it's a wonderful thing to make differences, positive impacts on people's lives. So thanks again, Gregg.
You're welcome. Thank you, Harlan.
All right, folks. Glad you were able to join with us today. Hope you enjoyed that conversation with Gregg. Don't forget, you can go out there and find him on LinkedIn as well. I'm sure he'd be happy to connect with you. He will not stalk you and make you have a meeting with him, but if you request a meeting, you will be very engaged and you'll get to learn some awesome things about what he's doing. So I highly recommend that. Don't forget, if you have not subscribed to the Health and Well Power Hour, you can do that by going out to hwpowerhour.com. That's hwpowerhour.com, and go ahead and subscribe. Otherwise, you can just go ahead and continue to consume it on all the regular places: Apple, Google, Spotify, all those things. I believe we're on Amazon now as well, so you can check it out there too. And don't forget, we got a couple of other things going on. The last Tuesday of every month, we have our monthly audio room on LinkedIn called Why Does Healthcare Suck? That's right. Why Does Healthcare Suck? It is our monthly dive into different parts of the healthcare system and all the things that are wrong with it. But we also provide solutions. It's not just what's wrong, but how can we also fix it or help you not to get trapped into bad healthcare situations. That is at 11 a.m. Central Time, last Tuesday of every month. And we have restarted our Broker's Edge Kickstart series. That is 10 a.m. Central Time every Monday. That is a LinkedIn live audio event, but it is spread across LinkedIn, also Facebook and Instagram and YouTube. So you can catch it on any of those platforms. It is a monthly news and trend update. I give you all the latest things going on in the industry and trends that may also affect you as well. So whether you're a broker, an employer, a DPC, doctor, doesn't really matter where you are, or just a consumer out there and you want to know about what's going on in our industry, I give you that update. Once again, thank you for being here. We appreciate all the time you spend with us. We will catch you on our next show. Thank you for joining the Health and Well Power Hour. We are out.